With us now is Dr. Amar Mashru from the Justice for Health group that mounted the legal bid against Jeremy Hunt's plans to impose that new contract. Dr. Mashru, thank you very much for coming in. On the three main points the judge found in favour of the government, how is this anything but a defeat for you?
To the contrary, this is a hugely significant day. So by taking the case to the High Court, we finally now have the clarity that the Health Secretary has decided at the last moment to avoid a legal loss, that he is no longer imposing a contract on junior doctors. In terms of moving forward, in terms of clarity of the situation, that's a very significant development. More interestingly, in some regards than that, he's also claiming now, to avoid the judge ruling against him, that he was never imposing a contract on junior doctors.
So it is time, in your view, to move on. Now you've got that clarity. He's not imposing it, but the trusts who employ junior doctors say they want a single contract. It's a good idea. When are you going to sign and accept and move on? Yeah,
exactly. So what is now possible, we've created much more freedom with regards to the implementation and changes of any new contracts. They're no longer under the auspices of the Secretary of State. They're now a realistic negotiation between the employers and the employees.
So you're going to have multiple negotiations with different employers?
The premise of a single contract is the ideal goal. What this now means is that in terms of working that contract out, this can be a conversation that occurs at a national level between employees and employers, so represented by the BMA and CEOs, and it may even mean that we are no longer under the same timeline that Hunt had initially set. So if there are safety concerns, for example, as I'm sure you're well aware, a lot of the issues with the new contract was how it would ever even work. Those can all be planned and worked for first before implementation of this new contract is enrolled.
So how much further forward are you really in terms of signing this contract and avoiding further strikes?
So this has completely changed the field now. So we're now in a much more sensible situation where we're actually talking the people that are delivering healthcare and the people that are in charge of the trusts can now start to talk about how this new contract is really going to work, what changes need to be made, and how it's actually going to deliver safer care for patients and for staff. Because the big concern with the contract that Jeremy Hunt was imposing from next week, which he no longer now can, is that it was never going to deliver what it aimed to because it was trying to stretch too few staff too far.
Dr. Amar Mashru, just from Justice for Health. We'll watch how it progresses. Thank you very much for coming in.